Good afternoon. My name is Carlos Becerra. I'm a medical oncologist by training, and I work at Baylor University Medical Center in Dallas. My main areas of interest are GI oncology with a special focus on pancreas adenocarcinoma studies, of which I have several available. What are some of the medical comorbidities that would lead you to avoid or prefer certain chemotherapy regimens when treating pancreatic cancer? The adequate assessment of patients with pancreas cancer is very important in order to determine whether they would benefit at all from the current active chemotherapy regimens. Some patients present initially with a very poor performance status due to the tumor itself and not to potentially reversible conditions. In this patient population, the risk-benefit ratio for treatment with chemotherapy is high, and thus they will best be served by comfort measures instead of chemotherapy or by single-agent chemotherapy such as gemcitabine. In patients that present with obstructive jaundice, I'll wait for the bilirubin to improve after placement of a biliary stent prior to initiating chemotherapy, whether it be FOLFIRINOX or gemcitabine and Abraxane. In patients with underlying neuropathy due to underlying conditions such as diabetes mellitus, I prefer to use gemcitabine and Abraxane over FOLFIRINOX, since the neuropathy associated with Abraxane tends to be short-lived when the Abraxane is reduced or held. Also, keep in mind that both oxaliplatin-based regimens and Abraxane in combination with gemcitabine have the risk of pneumonitis as a potential toxicity. So in patients with a marginal lung capacity, we must assess the risk-benefit ratio and keep a close eye on the respiratory and oxygenation status of the patient. Some patients have received and have developed an allergic reaction to a cisplatin for a different malignancy. In this particular clinical scenario, I avoid the use of oxaliplatin due to the potential for cross-allergic reactions. In patients with underlying cardiac history, such as congestive heart failure or arrhythmias, I avoid the use of Abraxane due to the increased risk of worsening of their cardiac condition.